map. The lower the number, the higher the dose, sort of. All the doses concentrated here in the middle. It wasn't bad for the time. That was the best we had. That was all the computing systems could handle back in the mid-90s. And it was considered high tech for the day. There was a lot of issues with it, though, not the least of which was that we didn't have a clue what was going on above or below this plane. This was just one area of calculations, and running what was called an off-axis calculation, trying to find out what was going on above or below, took like 45 minutes of computing time. Well, those days are all gone, and this treatment planning system has taken its place in the Museum of Radiation Oncology. Now we're all 3D. These computers now will crunch out, patient volumes that look like this, where we're still unimaginative. Bladder is still yellow, rectum is still brown. This is the prostate gland. This is a patient's outline here, and these are the pelvic bones. But it gives us a lot higher resolution when it comes to figuring out what kind of radiation dose is being absorbed by the body. We started our 3D program in 1996 here, and then we actually left 3D in mid-2000 in favor of IMRT, intensity modulation. We've been doing that up to this afternoon. That's our current treatment planning platform. We get pretty elaborate, too, with knowing how much tumor somebody's got. When we do our treatment planning for the external beam, we use an MRI scan when we can to help us stage the patient.